New at 6, across Ohio, independent pharmacies are disappearing. More than 250 have closed in the state in the past 10 years.
They are shutting their doors even when they are serving more customers and writing more prescriptions, but are still losing money. Why exactly is this happening, and why should you care?
10 TV's Kevin Landers is following the money.
The plain truth.
Pharmacies all across the country are closing.
Thank you very much.
About the Plain City druggist.
It's really sad, and it's angering because I had plenty of customers.
Is that Joe Kraft's drugstore is done. The depleted shelves make that clear.
My wife and I have done this together for 25 years. It's all I've ever wanted to do. And it's over, all because of greed.
He blames his demise on pharmacy benefit managers, or PBMs.
We've been struggling for the past 3 years. Last year we lost $311,000.
PBMs are middlemen in the drug supply chain that act on behalf of insurers. Kraft says what hurt his bottom line are what's called clawbacks. In the pharmacy world, if your copayment is $20 and the drug actually costs $15, PBMs and insurers claw back the $5 difference for profit.
Kraft showed us this spreadsheet, which illustrates the problem. He says since 2016, he lost nearly $2 million in clawbacks from PBMs. As a result, he says he had no choice but to close his 4 pharmacies in February.
His closings leave Madison County, population 44,000, with only 2 independent pharmacies.
We've come to Joe for 20-some years, and when we heard he was closing, I panicked, because I didn't want to go to Walgreens because that's further away from me.
Let me send this down to Ernie and see what he can do.
For most of Joe Kraft's customers, it's the only pharmacy they've known.
I've been coming here for 24 years, every day.
This closing is like a funeral for a friend.
When my mother-in-law passed away, Joe sent us a personalized card. You don't find that.
Total is 24.
Independent pharmacies, including large chains, are vanishing across Ohio and across the country. The fewer the pharmacies, the harder for customers to shop for better prices.
When independent pharmacies close, they're leaving a pharmacy desert.
Ronna Hauser is the Senior Vice President of Policy for the National Community Pharmacists Association.
Your local story about 4 independent pharmacies closing is all too common these days.
Since 2014, more than 250 independent pharmacies have closed across the state.
I had the desire and the will to help take care of people in my community, and it's all gone.
Pharmacy benefit managers control 80% of drug prices. They go by the names of Optum Rx, owned by United Health, Express Scripts, owned by Cigna, and CVS, owned by Aetna. They determine which drugs your insurance will cover, where you get your prescriptions filled, and your copay.
Well, the system is designed to create haves and have-nots.
Antonio Chacha studies prescription drug prices.
The PBM is setting the prices at the pharmacy counter. They can manipulate those prices to be artificially low or artificially high. When artificially high, what happens is that the patient is overpaying for medicine.
When states learned they were getting fleeced by PBMs in the Medicare Part D program, which covers prescriptions for the elderly, they sued, charging a violation of the state's antitrust laws. Ohio was one of the first, led by Attorney General Dave Yost.
It's raising prices, it's distorting the marketplace, and that's why we're challenging their anti-competitive, anti-market business model.
You too, you take care.
As for Joe Kraft's customers, many of whom are elderly and on fixed incomes, the death of this drugstore is more than a loss of a pharmacy. It's a loss of community, too.
It's just a shame. It's a shame that we don't have a pharmacy anymore.
Kevin Landers, 10 TV News.
Now, the Pharmaceutical Care Management Association has fought back against negative press about its practices. They didn't respond to 10 TV's request for comment, but according to a statement on the company's website, quote, proponents of policies targeting pharmacy benefit companies ignore the costly repercussions of undermining pharmacy benefit managers' ability to secure savings that enable health plan sponsors to offer quality, affordable prescription drug benefits. There is a reason Big Pharma supports anti-PBM policies, because they stand to reap higher profits at the expense of patients, plan sponsors, and the healthcare system.